think this is COVID Chronicles 102.
I didn't let any chipmunks in today. I just want to read to you what I finally found that puts the finger on what bothers me when I go to the States that doesn't bother me when I'm here, okay?
What isn't happening in Canada that is happening in the USA?
Yes.
All right.
When American friends ask for an explanation, I encourage them to reflect on the last time they bought groceries at their neighborhood Safeway. In the U.S., there is almost always a racial, economic, cultural, and educational chasm. Is that how you say that word?
Chasm.
Between the consumer and the checkout staff that is difficult, if not impossible, to bridge. In Canada, the experience is quite different. One interacts, if not as peers, certainly as members of a wider community. The reason for this is very simple. The checkout person may not share your level of affluence, but they know that they are getting a living wage because of unions, and they know that their kids and yours most probably go to the same neighborhood public school. That's a lot of traffic. Third and most essential, they know that if their children get sick, they will get exactly the same level of medical care, not only of your children, but of those of the Prime Minister. These three strands woven together become the fabric of Canadian social democracy.
At least that's what I think as well, except I've noticed that there are, with the passage of time, I've noticed that there are Canadians who have a very, what I would consider an American attitude. I used to think of it, that's what when I would bump into it, it's, oh, that's an American attitude, that's weird, but it's not necessarily an American thing. It's more like on that spectrum between conservative, far conservative, and liberal, far liberal. There's a sweet spot that I thought I was living in Canada, that everybody had that kind of approach. And then I realized as I got older, not everybody does in Canada either, but there's just more of us. And some key events took place at key points in time such that we have, our healthcare system the way it is today. I mean, it could have gone further. Like, we didn't include dental. We didn't include eye care.
Medication.
No,
we don't have medication. It's private insurance has some medication.
So there's a bunch of things that didn't get covered. And there are other countries that do it, I guess, better, in more comprehensive ways. But I still, like, what I grew up with was that we take care of each other, was the general thought. And the so-called American version of that isn't we take care of each other. Like, there are people in the States that like that, but their system isn't we take care of each other. It's kind of like almost every man for himself. It's like, if you haven't worked hard enough to have what you need, then sucks to be you. And supposedly
mosquitoes are supposed to be dead by now.
Supposedly the way it's supposed to work in the States is those that don't have will benefit from those who donate to charities. That's kind of like the solution I hear mentioned from time to time. It's like, oh, it's not all bad in the States. Those who have a lot of money would be donating it to take care of those who don't have any money. And I'm thinking,
yeah, right.
I don't know. I mean, that might be true on a minor scale, but it's not doesn't seem to be true on the scale that it's needed.
Flies? We never have flies.
Well, you're the one who wanted to come outside.
Look, I put my eyebrows on.
Yeah.
I also noticed it in, I thought that because I was home and I know some of the checkout ladies at the grocery store, that we have more to talk about, like, they're either going to school or they're not, or what they're doing or how it's going, especially in COVID. But when you're in the States and we talk to everybody, right?
Yep.
But the people that go there all the time to these stores aren't talking to the checkout people.
Different vibes in different places, yeah.
And it's very black and white. Like, you almost generate fear in a person of color when you talk to them there.
Yeah, they don't.
know how to react. My
Yeah.
God, it's a white person talking to me. Am I going to be in trouble?
Yeah.
It's horrible.
But it's a different. It depends where you are, but it's a different attitude or different perspective on different expectations. Is the way I see it. My expectation is we're all going to take care of each other, and even in Canada, I see situations that, hang on, this is not consistent with all taking care of each other. Like certain, even the way certain things are done in certain locations, like it's like lip service. You know, we call this a harassment-free area, for which there will be no tolerance of any harassment. Then you find out, well, that's not true, and you're surprised. Like
rampant in the government. Also,
you know?
Don't think our government is perfect. It's not.
The bureaucracy, the administrative side of government offices, yeah, it's like there's. I mean, it's nice to know that on paper it's supposed to be a certain way. It's comforting until you bump into the situation where it wasn't the way it was supposed to be, and then you realize how indifferent some people are to the fact that it isn't the way it's supposed to be. And I see that in a lot of different things. Like on paper, certain things are supposed to be a certain way. Like my skydiving experience. You know, as an instructor, I was expecting we were all doing things in accordance with industry's best practices and such like that, and the specific rules stated. And then over time, I began to realize there were a lot of people who were just, doing it our way, doing what we think we...
Don't care if some students die.
Well, I wouldn't say... don't care if students die would be kind of a little bit of an overstatement, because these people never expected anyone to get hurt or die, because they thought that they were like everybody does, right? Like if you're doing anything you know you're not supposed to do, and you think, yeah, but it's going to be fine, XYZ, right? So what was a problem was to say, look, this is the standard we promised to uphold. Why aren't we upholding it? And then people, it's just like they lose their composure. They can't interact with being told, you made a commitment, you're not keeping it. As it used to be, as my experience was, as a member of the organization, you agreed to do X, Y, and Z.
But if you don't do that, are you not saying we don't care about the students'
well,
lives?
no, because
people saying that.
Inherently, I think they are doing that, but that's not what they're thinking. What they're thinking is,
we can save money.
This isn't going to be a problem. Despite the fact that I'm cutting a corner here, it's not going to be a problem. And in reality, maybe often it isn't. But the fact is, when somebody else says, hey, I signed the same piece of paper you signed, and I want to do things as per the promise we made, and then when somebody else says,
we don't
care,
I tell you.
When somebody else says they don't care, then that's when it gets messy, because then it becomes falling to the lowest standard. Like, what's the standard everybody does agree they want to uphold? Well, it's here. Where it's supposed to be is up here, but
we're okay
it's
with
here
that.
because
Till
a bunch of people don't want to do this. They're here, and then the risk is increased. Anyway, that's where I ended up separating from skydiving in Canada, because the organization refused to. It was more of a marketing thing to claim that there was some organization in place that everybody was a member of that upheld standards. That sounded good. The fact that those standards were uniformly upheld, and even the organization didn't want to police it, was problematic.
Not good. Anything else to say? We've probably gone over time. That's it for us. Remember how I look with mascara and eyebrows, because it probably won't happen again till the 200th COVID Chronicle.
Oh, okay.